Hi, my name is Meng Huang. I'm a neurosurgeon from Houston, Texas in the United States. I practice at a hospital called Methodist Hospital. It's right in the middle of the Texas Medical Center, which you may have heard of. It's one of the largest medical centers in the whole nation. In the United States, minimally invasive surgery for disc surgery, either in the cervical, or thoracic, or lumbar spine, predominantly is still done through traditional open procedures. There's very few surgeons in the U.S. who practice with an endoscopic approach to these problems. Doing some endoscopy myself, learning from the few handful of doctors in the U.S. who are doing a lot of endoscopy. Now I'm hoping to get more experience and really further my own understanding of endoscopic spine surgery. There's several differences. Well, first of all, it really depends on what practice setting you're in the U.S. Like, for example, for me, I'm in a very large tertiary referral hospital, but we take care of, our hospital in general takes care of many, many problems. Wooridul Hospital is, from what I've seen, is basically a spine-specific hospital that only takes care of spine patients. But obviously, this hospital does the most complex, but also the least invasive types of procedures too. So I think, this hospital is very focused, but still covers, of course, all of the aspects of spine surgery. Comparatively, we similarly cover all the varying pathologies that affect the human spine, but we're also very much integrated with a large hospital system that takes care of all other patients as well. Well, every case is interesting. I find that, even after graduating from training and being in practice for several years, anytime I see anyone else do a procedure, I still find that I learn something new, whether it's from technique or, even how patients are positioned. Every single endoscopic surgery is always fascinating to me, which is why I'm so interested. And just being able to see the surgeons here and their various techniques for approaching the disc and for how they decompress the nerves and achieve the end surgical goal. Everything is interesting. Oh, absolutely. I mean, first of all, there's so much history behind this hospital. Some of the pioneers in endoscopic surgery, have all been practicing here in this hospital, and with the amount of actual sheer surgical volume, with many of these surgeons performing over 100 surgeries per month is just incredible. So that your patients are coming to a place where surgeons are well trained and extremely experienced, and I think it's a wonderful setting.